Let's get back to Dr. Neil Sharma from Eye and Retina Specialists. Jeff, you've got a question for Neil. Go right ahead, he's listening.
Yeah, good afternoon, Chris. Thanks very much. Dr. Sharma, I've got vitreous separation, and I'm just wondering, cataract operations, once I have that and I've got a bit of clouded vision, once I have the cataract operation, does the vitreous separation or floaters become more obvious with my vision?
It's a very common question, so a very good question that you've asked. Essentially, vitreous separation refers to the jelly in the eye as people get into their 50s and 60s, becoming more of a liquid, and that's normal part of the aging process, that it will separate from the retina and can cause a few floaters, which are little opacities or clouding in the jelly of the eye itself, which people often will perceive as little spots, sometimes cobwebs or spiders or little flies in the vision. The good news is that almost always, except in very rare circumstances, they do get less obvious after a few months, and the brain adapts quite quickly.
Yes, that's true.
Cataract surgery may make them a little bit more common depending how thick your cataract is. Once you've had the operation, you might notice them a little bit more prominently for a short period of time. But after that, I would expect
that as well.
I would expect after a couple of months, they should be only, if you're looking at a plain blue sky or a white background or something, you might notice them in those circumstances. But in day-to-day activities, unless they're very large, most people do adapt and it doesn't cause any problems. So certainly it's not a reason not to have cataract surgery if your cataracts are needing to be done.
Okay, Jeff, thank you very much for your call. Cataracts. Now, is it one of the biggest problems facing our older Australians?
Cataracts are certainly a very common problem as people get into their 60s, 70s and 80s. It's a few misconceptions. People sometimes come to me and say they think a cataract is a skin growing over the surface of the eye, whereas it's actually a clouding of the lens inside the eye, a little bit like a camera has a lens. When we're young, it's nice and clear, like a clear window. And as we get into our older years, it does become a bit more cloudy or frosty. So I say to patients, when you're young, it's like a clear window. And as you get older, it's almost like looking through frosted windows. And so the vision can become more blurry. You can get glare and generally a little yellow discoloration of your everyday world. And so they're the most common symptoms of cataract. And certainly cataract surgery is one of the most commonly performed procedures.
Safe?
Of all the operations on any part of the body, it certainly has one of the lowest complication rates and one of the highest success rates. So modern cataract surgery is a very safe procedure, but like anything, there are some small risks which need to be discussed.
Okay. Amy, go right ahead.
Hi, Doctor. I just had a question. I wanted a second opinion. I went to see the doctor today and explained to him that I have, for the last few months, been experiencing heaviness in the muscle in my right eye. It feels like I don't have a lot of control in keeping my eye open at some times, and my left eye is completely fine. There's no issues there, but it just feels really heavy, feels really tired, and it sometimes my eyes feel sore as well. So I explained all this to the doctor today, and he basically didn't think that it was something serious and that I didn't need to pursue further. But I just want to get your opinion on the matter and see if that's something I need to, see a specialist about, perhaps.
Certainly, it's something that I suppose if I was to see you, or an ophthalmologist was to see you, would want to evaluate if there was a difference in the lid position between one eye to the other. There's a condition called an eyelid ptosis, where the eyelid becomes more droopy, and that can be either a true droopiness of the eyelid due to a weakness of the muscle, or the tendon that holds the muscle in place, or sometimes it can be due to extra skin or other sort of causes as well. So generally, it's hard without sort of examining you to sort of work out which of those it is, but there are certainly a range of causes of heaviness or drooping of the eyelids, either on one side or both, and working out what the cause then determines what recommendations regarding treatment, if any, is required.
Maybe a second opinion?
It would be worth sort of having an ophthalmologist look at it and then deciding from there.
Okay, from Amy, thank you for your call. Anne, go ahead.
Oh, good afternoon, both you gentlemen.
Hi.
Doctor, I am very concerned. I go to an ophthalmologist, and he said to me that I had the beginning of cataracts, and he said, it's perhaps better to have it done before it gets too bad. Now, I took his word for that. Now, I did do that, but my right eye was blurry. So I went back and I told them, and then I couldn't see him because you can't see him till March next year. But I saw another one and they lasered it. Now I'm seeing double vision. So what do you think could cause that, Doctor?
Is the double vision sort of with only one eye or with both eyes, I suppose, would be my initial question?
Well, it seems to be predominantly the right eye. If the left eye doesn't seem to do it, the left eye is really clear. The right eye is still blurry, and I have got double vision. So I thought, right, what do I do now?
I suppose from my point of view, it would be worth having a look at the eye to see if there's an obvious cause for it. Now, sometimes you can have some residual swelling or what we call macular edema, which is the macula is a central part of the vision, and most people have heard of macular degeneration. After cataract surgery, in a small number of people, you can get some swelling at the macula that causes ongoing blurring of vision, and there's a scan, a very high-resolution OCT scan that can detect that. If that is the case, treating that underlying macular swelling is important to control the fluid that's there and therefore improve the vision. So there are other causes of some blurry vision, whether it's a little bit of residual, what we call refractive error, or astigmatism, and whether a pair of glasses might help with that is the other common thing that can affect people after they've had the cataract surgery done. If you've had a laser procedure performed, I assume there's a little membrane over the lens itself that's been put in. So certainly it would be worth looking at, and March next year is probably a little long away, to be honest.
Maybe another referral to another specialist.
Or trying to see if you can get in earlier with the same one, whichever. But I think March next year is probably a little far away to be seen if you're having problems.
Good advice. Gay, go ahead.
Hi, Chris. Thanks for taking my call.
Okay.
Could I speak to Dr. Sharma, please?
Listening, yes.
Hi, Dr. Sharma. Look, my husband gets a lot of watery eyes, and they get really, really sore. They're not dry. They're actually watering all the time. And they get quite red because he's sort of trying to wipe them all the time. I don't know whether a friend of ours had the same problem, and he had blocked tear ducts, and that didn't seem to work with him, and I'm a bit hesitant to sort of go ahead and get anything done to my husband. So I'm just wondering whether you might know what it might be, please.
As people get older, there are the two very common causes of watery eyes.
Okay.
And the first one, it seems a bit counterintuitive, but dry eyes is certainly a cause of watering eyes. If your eyes become dry as you get older, the tears are not produced as well. Okay. And so therefore the eye tries to secrete extra tears to compensate, but generally the quality of those tears is not so good, and they can cause sort of trickling down the cheeks and, chronic irritation. So often we recommend a trial of what we call ocular lubricants, or just simple artificial teardrops you buy over the counter, to use those 3 or 4 times a day. And if that solves the problem, or at least helps the problem, then it's a fairly non-invasive and easy remedy. Now, the second most common cause is as you said earlier, a blockage of what we call the nasolacrimal duct. That's the duct that drains tears from the eye into the nose itself, and if that is blocked, it does need investigation and an operation to try and unblock what we call a DCR surgery. So he should have it looked at if it's causing him a chronic problem and irritating him.
Thank you for the query, Gay. Thank you for your call. Sorry to the other callers I couldn't get to. We can't continue our eye segment all afternoon. It's not like that. And Neil Sharma has things to do, like see patients, etc., etc. So thank you very much for coming in once again, and thank you very much for your very astute advice.
No, pleasure, Chris. I always enjoy coming in and helping where I can.
Great stuff. There you go. Dr. Neil Sharma, eye and retina specialists. Just go to the website eyeandretina.com.au. 1:45.